Michael is the CEO of Canna Verde Farm. Canna Verde Farm is a leading company in the space, headquartered in Canada with operations in Colombia. Michael, thank you so much for joining us today. Michael, when I started to learn about Canna Verde, one of the things that catch our attention in our investing group was these amazing LOIs and all the work that you have done regarding traction in the space. And what catch my attention the most was the numbers of LOIs and the numbers of traction, the level of traction that Canna Verde Pharma has acquired up today. So, well, welcome to Latino Investment Summit. Michael, it's an honor to have you here. Michael started his career as an analyst at Gluskin Sheff, a hedge fund catering to high net worth families based in Toronto, Canada. Following his career at Gluskin Sheff, he was appointed as an investment director at Infinite Potential Management, the private family office of the founders of BlackBerry. Prior to joining Canna Verde Pharma, Michael co-founded a cannabis-focused private equity firm where he served as a CEO and investment director. Michael is a CFA, charter holder, and holds an honor double major degree in economics and international studies from York University. Thank you so much once again, Michael, and tell us about Canna Verde Pharma. Welcome.
Perfect. Thank you very much for that kind introduction, and it's an honor to be here. Of course, we are very excited to present our company, which is Canna Verde Pharma. I'm going to share my screen and go through a quick presentation of Canna Verde Pharma. Then I'll be more than happy to take any questions that you may have. Perfect. So Canna Verde Pharma has a simple vision. We would like to become the leading medical cannabis company in Colombia and throughout Latin America. A quick introduction of Latin America, which is a space we're very, very excited about. Obviously, the population size, about 640 million people, which is nearly twice of that of the United States of America. And not only that, but throughout most of Latin America, medical cannabis has been legalized. So we're talking about Brazil, Argentina, Chile, Peru, Colombia, Mexico, and of course, Uruguay. So we do anticipate a very large market in Latin America, and of course, Colombia with its population of 50 million people. There have been many studies done in terms of projections of how large the cannabis market will be. There is one from the Brightfield Group, which has outlined that the legal cannabis market on a global basis is scheduled to reach $31 billion by 2021. Of course, as the other presenters have mentioned, regulatory risk is a big risk to worry about. However, we do realize that there is a movement towards the legalization of cannabis, and the first step would be the medical side of it, and then obviously following into the recreational side. Demand for medical cannabis is large. 68 million people would qualify for medical cannabis medication within Latin America, with chronic pain, anxiety, depression, and epilepsy being some of the major sources that we would require to have medication for. And of course, this is coming from the Brightfield Group as well. We have been in Colombia for a long time, and we're extremely excited about the opportunity that the country offers. The regulatory roadmap in Colombia is very difficult. It has taken us about 3 years to be able to achieve all of the licenses and permits needed for us to begin commercial cultivation. The process itself obviously starts with licenses for cultivation of low THC and high THC, extraction, manufacturing, genetics, and seeds, as well as going through in terms of not only receiving quotas for the scientific evaluation of the commercial strains, but also in terms of going through all of the processes involved in the permits with all the different regulatory bodies in Colombia. We're happy to report that Canna Verde Pharma, through its wholly owned subsidiary, which is Green Health Colombia, has achieved all of the licenses needed to operate. Specifically, we have licenses to cultivate, extract, manufacture, domestically distribute, and export both CBD and THC-based extracts. Furthermore, this year, we have registered 8 strains with varying CBD, THC, and CBG profiles with the Colombian Agricultural Institute, which we can now begin and take into commercial production and cultivation. Furthermore, we have an additional 57 strains with various THC profiles, and those are going through the registration as well, and we'll have those registered shortly. We are located just outside of Bucaramanga in a town called Mesa de los Santos, which gives us the perfect conditions to grow cannabis. We have built about 51,000 square feet of greenhouse space made up of 3 greenhouses, 2 10,000 square foot greenhouses, and 1 60,000 square foot greenhouse, from which we've completed half of that. The government mandate to become the world's largest producer and exporter of cannabis is what excites us about Colombia. Of course, the regulatory risk is present in every single jurisdiction that we've been a part of. Myself as a Canadian, we've obviously spent a great deal of time getting through the legislation and of course changing the legislation so that it better suits the needs of not only producers here in Canada, but the consumers as well. This is Green Health Colombia, which is fully licensed in Mesa de los Santos. The operation can be scaled to 415,000 square feet of cultivation space, and that is to yield about 6.6 million grams of cannabis oil at full production. On the left-hand side, you can see the greenhouses. On the right-hand side, you can see the cannabis, the flowers at the bottom left, and of course, our CBD extract on the bottom right. We believe that the management team is one of the most important aspects of an organization, specifically as it pertains to going through the regulatory risk that we needed to go through over the last 3 years to be able to achieve the things that we have achieved. I'd like to point out a few individuals on this slide. I'd like to start with the top right, Yvonne Osma, who's our Chief Medical Officer. Yvonne graduated from one of the most esteemed universities in Colombia, and he also went to Johns Hopkins and Harvard. He's served as a board member for Novartis, and he's also done numerous FDA monitored clinical trials. He is our Michael Jordan. Yvonne is going to assist us with a number of activities that I'll point out, and we're extremely excited to have him as the Chief Medical Officer. Eduardo Mayorga, who is our president, he is the founder of Green Health Colombia, and over the last 19 years, he has spent a great deal of time in management in Bogota Free Trade Zone, El Dorado Airport, BP Oil and Gas, and he does hold an MBA from U Externado. Dr. Peter Chen is the Chief Science Officer. He holds a PhD in food science from the University of Guelph. He is an expert when it comes to adding cannabis, both CBD and THC, to products, be them edibles or be them topicals. And of course, he's been a lead scientist for 2 cannabis producers here in Canada. Paul Robertson is our Chief Financial Officer. He has worked in Colombia over the last 10 years in the mining sector, and he has a distinct knowledge of the Colombian market and how that works. And of course, our rock star when it comes to cultivation, Shane Willen Stubbs, who has significant experience in the Canadian cannabis space. And Shane having been one of the highest yielders in Canada over the last various years. And Shane has agreed to join us about a year and a half ago. And he has not only gone to Colombia, but absolutely loves the country. Carlos Ulloa on our advisory board. Carlos has spent over the last 10 years caring for the well-being of performance athletes in Colombia. He also graduated from one of the most esteemed universities in Colombia, and he has been the team physician for the Colombian national soccer team, as well as the Olympic team and the tennis federation. Carlos has an intimate knowledge of what it takes to bring about medication and keep athletes in tip-top shape. And as we develop the relationship with Carlos, we are extremely interested in bringing forth products that can be used by people who play recreational sports, tennis, football, cycling. So we will be able to use his expertise to build these products, and then of course use his connections as well to be able to look at athletes, former athletes that would be able to put their faces behind our brands. Javier Patino used to be the general manager of Yambol. He's during his time there, he's increased revenues from 500 million to 200 million. He's done about 150 new product launches throughout Latin America. And he is we're going to use his expertise to be able to bring products to market and to design them properly. And Dr. Villegas is a pain specialist, having done so for the last 15 years. And he is the founder of one of the most recognized ophthalmology clinics in Medellin. And he is going to assist us with the pain medication as we evolved our prescription medication program. This is the most interesting project and the project that we're most excited about. It is a partnership, a clinical research partnership with Foscal Hospital to better help us design products for oncological pain relief. Foscal is one of the largest tertiary care centers in Colombia, comprised of 410 hospital beds, 350 medical specialists, and 300 medical consultants, and is located in Bucaramanga in the department of Santander. Not only that, but Ivan and his wife, Dr. Andrea Galvis, is assisting us with an applied research partnership and basic science partnership with a medical school and a university hospital in Western Colombia, and we will announce that shortly in terms of the details of that. We are focused on building a medical cannabis cluster in Santander, and we believe that Santander is the premier area in Colombia in terms of healthcare. So we have put together 3 companies: Green Health Colombia, our wholly owned subsidiary, Saludar, and Medical Precision Care. And what we're trying to do is we're trying to bring medication to patients. And within a few weeks, we will be one of the few companies in Santander to be able to write prescription for a variety of ailments for medical cannabis. And we will focus on the Formula Magistral, and we will focus on bringing forth new products for prescription medication. And Medical Precision Care is an INVIMA registered master pharmacy. And now they're in the process of obtaining an extension to include medical cannabis. JGB, we have signed a co-development agreement with JGB, which is a consumer packaged goods company with more than 1,000 employees within Colombia. The goal here is to integrate CBD into existing product lines, as well as develop new product lines that contain CBD. We've already developed 3 products. And of course, prior to COVID-19 and the total shutdown of not only Colombia, but the rest of the world, we've had to push back this project. However, we are close to bringing forth projects for the Colombian market in partnership with JGB. Promi is another consumer packaged goods company that manufacture cosmetic products and toiletries. We have signed a similar agreement to them to integrate CBD into their existing product lines, as well as bring new product lines containing CBD into manufacturing, marketing, and retail distribution. We have signed our first distribution agreement with the Faranda Hotels, which is a hotel group with properties in Spain, Colombia, Panama, Mexico, Dominican Republic, and Venezuela. We are going to place CBD-based products as toiletries in hotel rooms, and the first pilot program will focus on Hotel Casa La Factoria and Hotel Bantu in Cartagena. Again, we've had to push this back due to COVID-19, and obviously Cartagena being a major tourist destination. COVID-19 has decreased not only the amount of tourists, but of course ravaged the tourist industry in Cartagena. So we are ready to go in terms of this pilot project, and we will begin to do so as soon as it is safe for all of our employees and all of the stakeholders involved in getting this project up to speed. So as you can see, our strategy is to move away from cultivation, although we have all of the licenses that we need to be able to cultivate, extract, not only distribute, but also international export, and to move into partnerships that will enable us to become the leading company in terms of medical cannabis in Colombia. Furthermore, as the legislation develops into a recreational side of it, which we anticipate that will happen throughout the world, although it will happen in some places faster than will happen in others, we want to be able to take advantage of that opportunity with our topicals. We have edibles that we plan to bring forth, and of course, in terms of registration with INVIMA. So we are focusing on bringing all of these partners to the table that each has a specific skill set that together we can build a fantastic company to be proud of. Our capital structure is very simple. We have 12 million shares outstanding at a price per share of 60 Canadian cents for a valuation of $7.2 million. We also have about $3 million worth of debentures and about 88,000 warrants. So issued and outstanding, we have about 17.3 million shares, which is a valuation of approximately $10 million Canadian. And today we are raising capital, and we're seeking a minimum of 5 million Canadian dollars and a maximum of 10 million. It is a convertible unsecured 2-year debenture that yields 10% per year and has a mandatory conversion into common shares at 60 cents upon IPO or maturity. To date, we have raised $5.2 million, and most of that have gone into our operations in Colombia. So we're extremely proud to have used this capital to bring forth the medical cannabis market in Colombia, and to be able to build the greenhouses, the extraction facilities, as well as to develop all the relationships that we have done so in the past. The money will be used to complete the scientific evaluation with the Colombian Agricultural Institute, develop proprietary medical products for the Latin American market, assist doctors and clinics with the prescription of cannabis-based medication. We're going to finish our greenhouse build and our GMP-compliant extraction facility, and of course, the JV agreements that we plan to bring forth, as well as sales and marketing and operating expenses. That is the end of the presentation. Thank you very much for your time, and I look forward to any questions you may have.
Thank you so much, Michael. I'm inviting our charts that will be asking you a couple of questions, each of them. We have 4 charts today joining us. Coralie Borders from Aura Ventures, Douglas Gordon from Canex, Rohit Sharma from Indian Industrial Health Association, and Javier Hayes from Besinga. I would like to introduce first Coralie. Coralie Borders from Aura Venture. Coralie brings deep international supply chain operations and marketing experience to Aura Venture's mission of building high-velocity brands, making positive impacts around the globe. Having lived and worked across 4 continents, Coralie brings over a decade of international business experience, working with multinational conglomerates like Saint Gobain and in the agricultural, food, and beverage sector. She also launched and managed her own brand in business to customer verticals like direct trade chocolate, adding to her unique approach and understanding of how to build impact businesses. Welcome, Coralie. Thank you so much for joining us today. Coralie is representing Aura Ventures, one of the most trusted funds in the space, led by an incredible woman called Jennifer Sanders. It's always a pleasure to have female representatives within the venture capital arena, within the financial industry, and of course within cannabis. Welcome, Coralie, and feel free to ask Michael any questions that you